Welcome to Natural Health Harmony. At Natural Health Harmony, we believe in the healing power of nature. We are loved for our giveaways, health tips, DIY remedies. We will dive into the world of women's heath, sea moss, herbs, and natural supplements as we explore their benefits, share delicious and nutritious remedies, and offer advice for a healthier, more balanced life. Join our community of like-minded individuals dedicated to natural wellness and harmony. The information provided is solely based off of my own research and experience with working with others. I am not a physician. I encourage you to reach out to a professional to seek advice for any heath concerns. Menstruation, a natural biological process that nearly half the world's population experiences. Yet, for centuries, it has been met with silence, stigma, and even shame. Why is it that something so fundamental to human life is still misunderstood? Why do so many people grow up without proper education about their own bodies? And most importantly, how can we change that? Welcome to this essential session, where we break the myths, uncover the facts, and empower you with knowledge about menstruation. Whether you experience periods yourself, know someone who does, or simply want to understand this topic better, this conversation is for you. Because menstrual health isn't just a women's issue, it's a human issue. In the next hour, we'll explore the science behind the menstrual cycle, debunk common myths, and discuss practical ways to manage menstrual health with confidence and dignity. So, let's start this conversation, one that should have never been a taboo in the first place. Understanding the menstrual cycle. The menstrual cycle is a natural and essential biological process that prepares the female body for potential pregnancy. Let's explore the different stages of this cycle and understand how the egg develops and is released. Overview of the menstrual cycle. Throughout a woman's reproductive years, her ovaries will undergo approximately 450 menstrual or ovarian cycles. Each cycle follows a predictable sequence of events where several immature eggs begin the maturation process. However, typically, only one egg cell from either the left or right ovary fully matures and is released, while the others disintegrate. During menstruation, many women experience discomfort due to the shedding of the uterine lining, known as the endometrium. This process can lead to various symptoms, such as abdominal cramps, muscle pain, bloating, headaches, and gastrointestinal issues like diarrhea or constipation. Additionally, hormonal fluctuations can cause mood swings, though the intensity and type of symptoms vary from person to person. The development of follicles. Before the menstrual cycle begins, multiple follicles inside the ovary start to develop. These are called primary follicles, and each one consists of an immature egg surrounded by a layer of protective follicle cells. As the cycle progresses, one of these follicles continues to grow and matures into a Graafian follicle. This fully developed follicle contains an egg enclosed by fluid and follicular cells. Around the 14th day of the cycle, the Graafian follicle ruptures, releasing the mature egg into the oviduct, a process known as ovulation. Following ovulation, the remnants of the ruptured follicle transform into a structure called the corpus luteum. This temporary gland remains active for a short period, producing hormones that support the uterine lining. If fertilization does not occur, the corpus luteum gradually disintegrates, hormone levels decline, and the cycle resets with menstruation. Phases of the menstrual cycle. The menstrual cycle typically lasts around 28 days, but variations between 21 and 33 days are normal. It consists of 4 main phases. Phase 1, menstrual phase, day 1 to 5. The cycle begins with menstruation. This marks day 1, where the endometrial lining breaks down and exits the body through the vagina. The first few days often involve heavier bleeding, followed by a gradual reduction. Hormone levels are at their lowest during this phase. Phase 2, follicular phase, day 6 to 13. During this stage, the ovaries release estrogen, which stimulates the repair and thickening of the endometrium. By the end of this phase, menstruation ceases entirely, and the uterine lining becomes prepared for a potential pregnancy. Phase 3, ovulation, day 14. On approximately the 14th day, a mature egg is released from the ovary in response to a surge in luteinizing hormone, LH. This is the peak fertile window, and the egg travels through the fallopian tube, awaiting potential fertilization. Simultaneously, the Graafian follicle transforms into the corpus luteum, which secretes progesterone and some estrogen to maintain the uterine lining. Phase 4, luteal phase, day 15-28. This phase can be further divided into a fertile and an infertile period. Fertile phase, day 11-17. If sperm are present in the reproductive tract around ovulation, fertilization is possible. Sperm can survive for 2 to 3 days inside the female body, while the egg remains viable for 1 to 2 days after ovulation. This makes conception most likely within this window. Infertile phase, day 18-28. If fertilization does not occur, hormone levels drop, the corpus luteum breaks down, and the uterine lining prepares to shed. During this period, pregnancy is unlikely since no viable egg is present. Factors affecting the menstrual cycle. The menstrual cycle can be influenced by various factors, including hormonal imbalances. Fluctuations in estrogen and progesterone can alter cycle length and symptoms. Stress and lifestyle. High stress levels, extreme exercise, or sudden weight changes can impact ovulation and cycle regularity. Medical conditions. Conditions such as polycystic ovary syndrome, PCOS, thyroid disorders, and endometriosis can lead to irregular cycles. Contraceptive use. Birth control methods like hormonal pills or intrauterine devices, IUDs, can regulate or suppress menstruation. Conclusion. Understanding the menstrual cycle is essential for reproductive health and family planning. Each phase plays a vital role in preparing the body for a potential pregnancy, while hormonal fluctuations govern the changes in the uterus and ovaries. Although the cycle varies among individuals, being aware of its patterns and associated symptoms can help women better manage their health and well-being. Next, what's normal variability? So, what is considered normal when it comes to cycle variability? Cycle length. As mentioned earlier, cycles can range from 21 to 35 days. If your cycle consistently falls within this range, it's generally considered normal. Some women have shorter cycles, like 24 days, while others may have longer ones, up to 32 days. If this is your regular pattern, there's usually nothing to worry about. Period duration. The length of your period can also vary. Most periods last between 3 to 7 days. Some women may experience a shorter period of 2 to 3 days, while others may have a longer one. This can fluctuate due to factors like stress, diet, or lifestyle changes. Flow. Intensity. Another form of variability is how heavy or light your flow is. A typical period usually involves medium flow for 3-5 days. But some women have a lighter flow with just spotting or a heavier flow with more bleeding. As long as the pattern stays the same for you each cycle, this is considered normal. Ovulation variability. Ovulation can happen anywhere from day 11 to day 21 of your cycle. Some months, you might ovulate earlier or later than usual. Minor changes in ovulation timing can be normal, but dramatic shifts should be monitored. 3. When is variability a concern? While variability can be normal, there are some signs when cycle changes might indicate an underlying issue. Let's go over a few red flags. Irregular cycles. If your cycle suddenly becomes very irregular, for example, ranging from 21 days to 45 days within a few months, it may indicate a hormonal imbalance, stress, or a medical condition like PCOS, polycystic ovary syndrome, or thyroid disorders. It's worth seeing a doctor if this happens frequently. Very heavy periods. If you're soaking through pads or tampons in less than 2 hours, or experiencing very heavy bleeding for more than 7 days, it could be a sign of a condition like fibroids, endometriosis, or adenomyosis. This level of bleeding isn't considered normal and should be evaluated by a healthcare provider. Missing periods. If you're missing periods entirely or haven't had one in a while, especially if you're not pregnant, this could indicate amenorrhea, which can be caused by a variety of factors like stress, weight loss, excessive exercise, or more serious conditions like polycystic ovary syndrome, PCOS, or thyroid dysfunction. Painful periods. While some cramping is normal during menstruation, severe pain that interferes with daily activities may be a sign of endometriosis or fibroids. If you're experiencing debilitating pain each month, it's important to seek medical advice. Mid-cycle bleeding. Spotting or bleeding between periods isn't common and could indicate hormonal fluctuations, uterine fibroids, polyps, or other medical issues. If this happens, it's best to get it checked out. Changes in symptoms. If you notice a significant change in your PMS symptoms, such as increased mood swings, fatigue, or anxiety, it could be related to hormonal imbalances, or it could signal PMDD, premenstrual dysphoric disorder. If symptoms become disruptive, seek professional help. Break. We don't want you to be overloaded with information. Go and take a moment to process it first. Take a sip of that water, stand up, look far away. And if you're ready, come and go back here to continue taking these essentials. Ready? Okay. How to track your cycle. Tracking your menstrual cycle is one of the best ways to understand your body and stay on top of your health. By keeping track of your period, you can notice patterns, identify irregularities, and get an early warning about potential issues. Plus, it's a great tool when talking to your doctor about your health. How can you track your cycle effectively? Traditional paper calendar. If you prefer the old school method, a paper calendar works just as well. Simply mark the first day of your period every month, then track the length of your cycle. How many days pass between the first day of one period to the first day of the next? This method is especially useful for observing trends over time. How to use it. Mark your period's start date on the calendar. Record any symptoms you notice, like mood changes, cramping, or any unusual spotting. After a few months, review the calendar to see if your cycle is regular or if any irregularities pop up. Why it's useful. A paper calendar allows you to visually track your cycle and see any changes in your flow, pain levels, or frequency. Cycle tracking apps. Today, there are numerous cycle tracking apps available for smartphones, and they are incredibly popular for a reason. These apps make it easier than ever to track your period and any symptoms you experience. Many apps will calculate your cycle length, predict ovulation, and track mood changes. Popular apps include Clue, Flow, and Ovia. How to use it. Input the first day of your period into the app. Track any symptoms, such as cramps, headaches, hearts, or mood swings, and some apps will even allow you to log additional details like temperature or cervical mucus, which can help with fertility tracking. Most apps will predict your next period and ovulation window, helping you stay prepared for upcoming changes in your body. Why it's useful. Apps provide a convenient digital way to track your cycle, offering reminders and predictions based on the data you input. They can also store your information, so you have it readily available for doctor visits. Basal body temperature, BBT. Tracking. If you're trying to get pregnant or just want to understand your cycle even more deeply, tracking basal body temperature, BBT, is a helpful method. BBT refers to your body's temperature at rest, and it shifts slightly when you ovulate. How to use it. Take your temperature every morning at the same time, right when you wake up, before even getting out of bed. You can use a special BBT thermometer, which is more sensitive than a regular thermometer. Record the temperature each day in a chart or app. You'll notice a slight increase in temperature after ovulation, typically around 0.5 to 1 cm. This method works best when combined with other tracking methods, like observing cervical mucus, as these signs can give you a better idea of your fertile window. Why it's useful. Tracking BBT can give you a better understanding of your ovulation patterns, which is especially helpful for women trying to conceive or those looking to avoid pregnancy. Cervical mucus tracking. Another method for tracking your cycle is observing changes in cervical mucus. Throughout your cycle, the consistency of cervical mucus changes. Right after your period, the mucus is usually dry or sticky. As you approach ovulation, the mucus becomes clear, slippery, and stretchy. This is the most fertile time of the cycle. How to use it. Each day, check the consistency of your cervical mucus by wiping with toilet paper or using your fingers. Track the changes in texture and consistency each day to predict your fertile window. This can be done alongside BBT. Tracking for more accuracy. Why it's useful. Tracking cervical mucus helps you understand when you're most fertile, which is useful for those trying to conceive or practicing fertility awareness methods for contraception. Menstrual cup or period pad. Tracking if you use a menstrual cup or specific period pads. These can be useful tools for tracking your period flow. By noting how much blood you're losing and how often you need to change your cup or pad, you can track whether your flow is within the normal range or if any significant changes occur. A menstrual cup, for example, has a scale, so you can easily track the volume of blood you're losing. How to use it. Record the volume of blood you lose each day. A lighter flow usually means around 1-2 oz per day, while a heavier flow can mean 3+ Oz per day. Pay attention to any sudden changes in flow, such as heavier bleeding or unexpected spotting between periods. Why it's useful. Monitoring the volume of menstrual blood helps you keep track of any irregularities in your flow. This is particularly helpful if you experience excessively heavy periods or spotting, as it gives you a measurable way to assess your menstrual health. Journal your symptoms. If you're looking for a more detailed approach, journaling your symptoms on a daily basis can provide a fuller picture of your health. Keep a small notebook or use your phone's notes to jot down any physical or emotional symptoms you experience, such as bloating, cramping, mood swings, headaches, or even changes in skin or appetite. How to use it. Every day, write down any symptoms you notice. Record things like mood changes, energy levels, and any physical discomfort. If you track this regularly, you'll notice patterns emerge over time. Perhaps you find that you get extra tired or irritable in the luteal phase of your cycle, or you notice that certain foods cause more bloating during your period. Why it's useful. This method gives you a comprehensive understanding of your symptoms and allows you to see if they follow a cyclical pattern. It can also be useful when consulting a doctor, as it gives them a clear idea of how your cycle is affecting your daily life. How to use your cycle. Data. Tracking your cycle is incredibly useful, but what do you do with all the data? Here's how you can make the most of it. When to consult a doctor. If you notice drastic changes like missed periods, extremely heavy bleeding, or severe pain, track these changes over several cycles and bring them up during your next doctor visit. Having data on hand can help your doctor make an accurate diagnosis. Understanding your fertility window. By tracking ovulation and cervical mucus, you can determine your most fertile days for conception or avoid pregnancy naturally using the fertility awareness method. Better period management. Knowing when to expect your period and how heavy it might be allows you to plan ahead, whether it's choosing the right products or knowing when you need to rest more than usual. The key is to understand your body's natural rhythm and to pay attention to any significant changes. If you notice any red flags, like very heavy periods, severe pain, or missed cycles, don't hesitate to reach out to a healthcare provider to ensure everything is in check. Break. We don't want you to be overloaded with information. Go and take a moment to process it first. Take a sip of that water, stand up, look far away, and if you're ready, come and go back here to continue taking these essentials. Ready? Okay. Next, we'll be covering 5 key menstrual disorders: dysmenorrhea, PMS versus PMDD, PCOS, endometriosis, and irregular periods. Let's break down what these conditions are, how they affect menstruation, explore potential solutions, and when to seek medical advice. 1. Dysmenorrhea, painful periods. Let's start with dysmenorrhea, which refers to painful periods, a condition that affects a large number of women. Dysmenorrhea manifests as cramps, pain, and discomfort during menstruation, often accompanied by bloating, back pain, and headaches. There are 2 main types of dysmenorrhea. Primary dysmenorrhea is the more common form and occurs in women who are otherwise healthy. The pain results from the natural release of prostaglandins, chemicals that cause the uterine muscles to contract, leading to cramps. This pain can range from mild to severe, and typically begins just before or at the onset of menstruation. Secondary dysmenorrhea is caused by underlying health conditions like fibroids, endometriosis, or adenomyosis, and the pain tends to get worse over time. Solutions for dysmenorrhea. For primary dysmenorrhea, over-the-counter pain relievers like ibuprofen or naproxen are often effective in reducing pain and inflammation. Heat therapy, like applying a heating pad or warm compress to the lower abdomen, can significantly reduce cramps by improving blood flow to the area. Exercise might sound counterintuitive, but light physical activity, like walking or yoga, can help ease cramps and reduce discomfort by releasing endorphins, your body's natural pain relievers. If pain is severe, consider hormonal birth control options, which regulate the menstrual cycle and reduce the severity of cramps. In more severe cases, or if secondary dysmenorrhea is suspected, it's important to consult with a healthcare provider for further evaluation and treatment, which may include surgery in cases like endometriosis or fibroids. 2. PMS versus PMDD. Let's explore the difference between PMS, premenstrual syndrome, and PMDD, premenstrual dysphoric disorder. Many people are familiar with PMS because it's so common, but PMDD is much more intense and can severely affect emotional and physical health. PMS typically includes mild mood swings, bloating, fatigue, headaches, and mild irritability, and most women experience these symptoms in the days leading up to their period. These symptoms usually subside once menstruation begins. However, PMDD is a much more severe form of PMS. It can involve intense mood swings, severe depression, anxiety, irritability, and physical symptoms such as fatigue, joint pain, and sleep disturbances. PMDD can significantly affect your daily life, relationships, and work. Solutions for PMS and PMDD. Lifestyle changes. For both PMS and PMDD, maintaining a balanced diet, exercising regularly, and getting enough sleep can help alleviate symptoms. Supplements. Some studies suggest that taking calcium, magnesium, and vitamin B6 supplements may help reduce PMS symptoms. For PMDD, antidepressants or SSRI medications, selective serotonin reuptake inhibitors, may be prescribed to help regulate mood. Hormonal therapy, like birth control or hormone replacement therapy, HRT, is another option for women who suffer from PMDD. Cognitive behavioral therapy, CBT, and mindfulness practices like meditation and yoga can also be helpful for managing the emotional symptoms of PMDD. If symptoms are severe and interfere with daily life, seeking the help of a healthcare provider is crucial for managing PMDD. 3. PCOS, polycystic ovary syndrome. Next, let's talk about PCOS, or polycystic ovary syndrome. PCOS is a hormonal imbalance that affects about 1 in 10 women of reproductive age. It can lead to symptoms such as irregular periods, ovarian cysts, excessive hair growth, acne, and weight gain. One of the biggest challenges with PCOS is irregular menstruation, where periods may be delayed, missed, or overly heavy. This happens because the ovaries aren't releasing eggs regularly, disrupting the typical menstrual cycle. Solutions for PCOS. Birth control pills are commonly prescribed to help regulate periods and control the hormonal imbalance. Birth control can also help manage symptoms like acne and excessive hair growth. For women who are trying to conceive, medications like Clomid can stimulate ovulation and improve the chances of pregnancy. Metformin, a medication used to treat insulin resistance, can also help regulate periods and reduce symptoms. Lifestyle changes, including weight management through a healthy diet and regular exercise, are key for managing PCOS. Even a small reduction in weight can help improve insulin sensitivity and reduce the severity of symptoms. Hair removal treatments, like laser therapy or electrolysis, can be helpful for managing unwanted facial or body hair. If fertility is a concern, it's important to speak with a healthcare provider to explore options for treatment and family planning. Segment 4. Endometriosis. 3 minutes. Now, let's discuss endometriosis, a painful condition where tissue similar to the lining of the uterus grows outside of it, often on the ovaries, fallopian tubes, and other organs in the pelvic area. Each month, this tissue thickens, breaks down, and bleeds like it would inside the uterus. However, because there's no way for the blood to exit the body, it becomes trapped, causing pain and inflammation. The hallmark symptom of endometriosis is severe pelvic pain, often exacerbated during menstruation. Other symptoms include painful intercourse, heavy periods, and infertility. Solutions for endometriosis. Pain management is essential for endometriosis. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, can be used to manage pain and inflammation. Hormonal treatments, such as birth control pills, progesterone therapy, or IUDs, intrauterine devices, can help control the growth of endometrial tissue and reduce pain. For women with severe symptoms, surgery may be necessary to remove endometrial tissue, especially if other treatments have been ineffective. Laparoscopic surgery is a minimally invasive procedure often used to diagnose and treat endometriosis. If fertility is a concern, there are fertility treatments available, including in vitro fertilization, IVF, that can be considered after consulting with a specialist. 5. Irregular periods. Finally, let's talk about irregular periods. An irregular period refers to any deviation from your usual menstrual cycle. This can include skipped periods, heavier or lighter bleeding, or cycles that are either longer or shorter than usual. There are many causes of irregular periods, including stress, significant changes in weight, excessive exercise, or underlying medical conditions like thyroid disorders, PCOS, or endometriosis. Sometimes, irregular periods may also be a normal part of life, particularly during puberty or as women approach menopause. Solutions for irregular periods. If your irregular periods are due to lifestyle factors like stress or changes in weight, addressing those root causes can help restore a more regular cycle. For hormonal imbalances, medications like birth control or hormone replacement therapy, HRT, can help regulate periods. Thyroid medication may be needed if an underlying thyroid disorder is the cause of irregular periods. If irregular periods are due to a condition like PCOS or endometriosis, seeking medical treatment to address the underlying condition is important. Regular checkups with your healthcare provider are key for identifying any serious issues early and finding the right solution for you. Break. We don't want you to be overloaded with information. Go and take a moment to process it first. Take a sip of that water, stand up, look far away, and if you're ready, come and go back here to continue taking these essentials. Ready? Okay. Let's talk about the different menstrual products, how to choose the right one for you, and ways to maintain proper hygiene. We'll also clear up some common myths, so stick around for some helpful tips. First, let's talk about the different types of menstrual products out there. The most common ones are pads, tampons, menstrual cups, and period panties. Each product has its own pros and cons, and the best choice for you depends on factors like comfort, lifestyle, and your flow. Pads are one of the most traditional options and come in different sizes and absorbency levels. They're easy to use, but some people find them less comfortable during physical activity. Tampons, on the other hand, are inserted into the vagina and are discreet, making them a popular choice for many. But they do require more effort to use and should be changed regularly to avoid health risks. Next, we have menstrual cups. These are reusable, eco-friendly products that sit inside the vagina and collect menstrual blood. Many people love them for their sustainability and comfort, but they do require a bit of practice to get the hang of. And lastly, we have period panties, which look and feel like regular underwear but have built-in absorbent layers to catch menstrual flow. They're a great option for lighter days or as backup protection. When choosing the right menstrual product, consider factors like comfort, your lifestyle, and how heavy your flow is. For example, if you have a heavier flow, you might prefer pads or tampons with extra absorbency. If you're active and often on the go, tampons, menstrual cups, or period panties might be a better choice. Comfort is key, so don't be afraid to try a few different options to see what works best for you. Now let's talk about hygiene. It's important to maintain proper hygiene during your period to prevent infections and other issues. Always wash your hands before and after handling any menstrual products. Change your pads or tampons every 4-8 hours to avoid bacterial growth, and make sure to clean yourself with mild, unscented soap and water. When using a menstrual cup, remember to sterilize it after each cycle. For those of you looking for eco-friendly options, there are many sustainable period care products to choose from. Menstrual cups are a great option for reducing waste since they can last for years. Cloth pads are also an alternative, offering a reusable, sustainable option for those who prefer pads. And of course, period panties are a great way to minimize waste while staying comfortable. And now, let's address some common myths about menstruation hygiene. You may have heard that you shouldn't wash your hair during your period, or that using a tampon for too long can cause toxic shock syndrome. Well, let's clear that up. There's no scientific evidence to support the idea that washing your hair during your period is harmful, so feel free to keep your usual hygiene routine. As for tampons, as long as they are used correctly and changed regularly, there's no need to worry about toxic shock syndrome. To wrap it up, when it comes to period hygiene, choose products that work best for your body and lifestyle, and always maintain good hygiene practices to stay healthy. And remember, there's no one-size-fits-all solution, so don't be afraid to experiment and find what makes you feel most comfortable. We're diving into some essential nutrition and lifestyle tips that can help you manage your period with ease. From foods that relieve cramps to the role of hydration and stress, we're going to cover all the ways you can support your body during your cycle. First, let's talk about foods that can help relieve cramps and boost your energy. Menstrual cramps are one of the most common complaints during your period, and the right foods can make a big difference. Incorporating foods rich in magnesium, such as spinach, almonds, and avocados, can help relax your muscles and reduce cramps. Omega-3 fatty acids, found in fatty fish like salmon, or plant-based sources like chia seeds, can also help reduce inflammation. Don't forget about energy-boosting foods during your period. Iron-rich foods like leafy greens, beans, and lean meats are essential to replenish what you lose during menstruation. Additionally, complex carbs like whole grains and sweet potatoes provide steady energy without the blood sugar crashes that can leave you feeling tired and sluggish. Now, let's talk about the importance of hydration. Staying hydrated during your period is crucial. Dehydration can actually worsen cramps and bloating, making things feel a lot worse. Aim for plenty of water throughout the day, and consider adding herbal teas like ginger or peppermint, which can not only help with hydration, but also ease nausea and cramps. Let's move on to exercise and how it supports your period health. While you may not feel like working out during your period, light exercise can actually help alleviate cramps and improve your mood. Activities like walking, yoga, or swimming can increase blood flow, relax your muscles, and release endorphins, which are your body's natural painkillers. So don't be afraid to stay active. Just listen to your body and take it easy if you need to. Now, one factor that often gets overlooked in period health is stress. High levels of stress can impact your menstrual cycle in several ways. It can increase the severity of cramps, lead to irregular periods, or even delay your cycle. Practicing stress-reducing techniques like deep breathing, meditation, or journaling can help you manage stress levels and keep your cycle running smoothly. Speaking of managing your body, don't forget the importance of sleep. Your body needs proper rest to regulate hormones, and poor sleep can exacerbate period symptoms like fatigue and mood swings. Aim for at least 7 to 8 hours of quality sleep each night, creating a relaxing nighttime routine. Whether it's reading a book, taking a warm bath, or practicing mindfulness, can help you unwind and improve the quality of your sleep. Now, let's address a common question: natural remedies versus medication for period pain. When it comes to managing cramps or discomfort, you have options. Natural remedies, like a warm heating pad, herbal teas, or essential oils, like lavender or clary sage, can provide relief without the need for medication. However, if your cramps are particularly painful or persistent, over-the-counter medications like ibuprofen can be effective for managing pain and reducing inflammation. The key is to find what works best for you, and if your pain is severe, always consult a healthcare professional. To wrap things up, nourishing your body with the right foods, staying hydrated, getting regular exercise, managing stress, and prioritizing sleep all play a huge role in supporting your menstrual health. And remember, there are both natural and medical ways to manage period pain. It's all about finding balance and what works best for your unique body. Thanks for tuning in today. If you take care of your body with the right nutrition and self-care habits, you'll be able to manage your period with ease. Be sure to share these tips with anyone who might find them helpful. And as always, take care of yourself. Until next time. Break. We don't want you to be overloaded with information. Go and take a moment to process it first. Take a sip of that water, stand up, look far away. And if you're ready, come and go back here to continue taking these essentials. Ready? Okay. We'll explore cultural perspectives on menstruation, break some long-standing taboos, and highlight the importance of advocacy for menstrual health. Menstruation, while a natural and normal biological process, has been surrounded by stigma and silence for centuries. Today, we're going to delve into how different cultures view menstruation, the impact of stigma, and the powerful role education plays in changing these perceptions. Let's get started. Menstruation is viewed very differently across cultures. In some parts of the world, it's seen as a natural and sacred event, while in others, it's considered shameful or even dirty. In certain cultures, menstruating women are isolated, excluded from certain activities, or expected to follow strict rituals. For example, in parts of India, women are often sent to menstrual huts during their periods, seen as unclean. In contrast, many indigenous cultures in North America celebrate menstruation as a spiritual transition, honoring women's cycles as a powerful connection to nature. Despite these varying perspectives, the stigma surrounding menstruation remains widespread, affecting women's education, employment, and social standing. Menstrual stigma often manifests in the form of silence, shame, or negative stereotypes. In many countries, young girls are taught to hide their menstruation, using euphemisms like "that time of the month." This creates a culture of embarrassment and misinformation. The impact of this stigma is not just emotional, it's practical. In some regions, girls miss school during their periods because they lack access to menstrual products or are forced to stay home due to cultural restrictions. In the workplace, women often face discrimination or are expected to conceal their menstruation, which can affect their productivity and mental well-being. This stigma, reinforces harmful gender norms, and limits opportunities for women in all areas of life. So what can be done to break these taboos? Education plays a critical role in normalizing menstrual health discussions. When young people, both girls and boys, are taught about menstruation from a young age, it becomes a part of regular conversation. Schools can implement comprehensive menstrual education programs that cover everything from the biological process of menstruation to the importance of hygiene and the impact of menstruation on physical and emotional health. Advocacy efforts are also vital in shifting attitudes and providing access to the resources needed for menstrual health. One of the major challenges today is period poverty, the lack of access to affordable and hygienic menstrual products. In many parts of the world, including developed countries, women and girls are forced to choose between food and menstrual products. Organizations and advocates are fighting to ensure that menstrual products are available to everyone, regardless of their economic status. Several initiatives are actively working to provide free or low-cost menstrual products in schools and communities. These programs are not just about providing products. They're about breaking the silence, changing perceptions, and creating an environment where menstruation is not something to be ashamed of. From menstrual product donations to policy changes, advocates are raising awareness and pushing for systemic changes that benefit everyone. Breaking the taboo around menstruation and ensuring that everyone has access to the resources they need is a global effort. We all have a role to play in challenging stigma, promoting education, and advocating for menstrual health rights. It's time to have open conversations, support policy changes, and empower people to embrace menstruation as a natural, normal part of life. To sum up, menstruation is an issue that affects millions, and yet it remains shrouded in shame and silence in many cultures. The more we talk about it, the more we normalize it, and that's when real change happens. Together we can break the taboo and fight for accessible menstrual products for all. Let's keep the conversation going. We'll explore the importance of talking openly about menstrual health. For far too long, menstruation has been shrouded in silence, stigma, and taboo. It's time to break that silence and foster open, honest conversations. Menstrual health isn't just a women's issue. It affects everyone, and the more we talk about it, the better we can support each other and ensure that no one is left behind. Let's dive in. Menstruation is a natural biological process that half of the world's population experiences, yet it's still treated as something to hide or feel ashamed of. How many times have you heard someone whisper, "I'm on my period," or say, "It's that time of the month"? These euphemisms are rooted in a culture of silence and shame, making it difficult for people to fully understand or discuss menstrual health openly. The impact of this silence is far-reaching. When we don't talk about menstrual health, it becomes easier to ignore the challenges that many face. Girls may suffer in silence because they don't have access to the right products. Women may feel embarrassed or even isolated due to physical or emotional symptoms of menstruation. And this stigma can also contribute to discrimination in the workplace, schools, and even at home. When we keep quiet, we perpetuate the cycle of misunderstanding and under-support. Talking openly about menstrual health leads to greater understanding and awareness. The more we normalize conversations about menstruation, the more we empower others to seek help, access resources, and share their experiences. This leads to better education for both girls and boys about the biological process of menstruation, the importance of menstrual hygiene, and how to manage menstrual health. It can also foster empathy and reduce harmful stereotypes and misconceptions. By opening up the conversation, we can break down barriers that prevent people from getting the support they need. When menstruation is treated as a taboo subject, many individuals may feel embarrassed to talk about menstrual problems like cramps, heavy bleeding, or irregular cycles. But these are real issues that need attention. By talking about it openly, we create an environment where people feel comfortable seeking advice from healthcare providers, discussing options with their peers, and receiving proper care. Open conversations about menstrual health also lead to better accessibility to menstrual products, medical help, and support. When we speak freely about the challenges of menstruation, we raise awareness of issues like period poverty, where individuals can't afford menstrual products. This can drive societal change, leading to policies that make products more accessible or even free in schools and public places. The more we talk about it, the more we create a society that listens, understands, and takes action. Talking openly about menstrual health is also about advocacy. Advocacy means supporting efforts to create better solutions, whether that's in the form of better access to products, improved health services, or breaking down societal taboos. The more we talk about menstrual health, the more we strengthen the voice of those who are fighting for equality and better rights for menstruators everywhere. Together, we can ensure that everyone has access to the resources, education, and support they need to manage their menstrual health with dignity. So how do we start these conversations? It can be as simple as asking someone how they're doing, offering a supportive word, or sharing educational resources. Schools, workplaces, and communities should also actively promote open discussions through workshops, information campaigns, or policy changes. It's about creating safe spaces where people can talk about their experiences, concerns, and needs without fear of judgment. To wrap it up, menstruation is a topic that affects us all, and it's time we stop treating it as a taboo. By talking openly about menstrual health, we can break the silence, reduce stigma, and ensure that everyone has access to the support, products, and education they need. The more we talk, the more we can change the conversation and improve lives. Break. We don't want you to be overloaded with information. Go and take a moment to process it first. Take a sip of that water, stand up, look far away. And if you're ready, come and go back here to continue taking these essentials. Ready? Okay. As we come to the end of this essential discussion on menstruation, let's take a moment to reflect on the key insights we've uncovered today. Menstruation is not just a biological process, it is a symbol of vitality, of strength, and of the body's remarkable ability to sustain life. It is something that half the world's population experiences, yet for centuries, it has been shrouded in myths, stigma, and misinformation. But today, we're breaking those barriers. Let's reinforce the most important takeaways from our session. Takeaway number 1: menstruation is a natural biological process, not a taboo. First and foremost, menstruation is completely normal. It's not something to be ashamed of, embarrassed about, or hidden away. This is a natural cycle, driven by the intricate dance of hormones in the female body. Yet, throughout history, menstruation has been whispered about in secrecy, often leading to shame and misinformation. The truth: every person who menstruates deserves access to accurate information, support, and dignity when it comes to their period. On average, a person will menstruate for about 7 years of their life in total. That's a significant part of human existence, one that deserves attention, respect, and understanding. Takeaway number 2: the menstrual cycle, is more than just bleeding. Menstruation is only one phase of a larger, beautifully complex cycle. From the follicular phase, where the body prepares for ovulation, to the luteal phase, where hormonal changes can trigger PMS symptoms, the cycle is a continuous flow of transformation and balance. Understanding these phases helps people work with their bodies, not against them. Knowing when hormones peak, when energy levels fluctuate, and when the body needs rest can lead to a healthier, more harmonious relationship with oneself. The average menstrual cycle lasts 28 days, but cycles between 21 and 35 days are still considered normal. Takeaway number 3, menstrual health is health, period. Would you ignore signs of a fever? Would you brush off severe migraines without concern? Then why should severe period pain, irregular cycles, or excessive bleeding ever be dismissed as normal? Conditions like PCOS, endometriosis, and PMDD are real, and they deserve medical attention. The body communicates through symptoms, and learning to listen is the first step toward better health. If your period is causing excessive pain, mood swings, or unusual changes, seek professional advice. Your body deserves care. An estimated 1 in 10 women worldwide suffer from endometriosis, yet it often takes years to be diagnosed due to stigma and misinformation. Takeaway number 4. Menstrual products should be a choice, not a privilege. Not everyone has access to sanitary products, and that's a problem. Period poverty affects millions of people, forcing them to use unsafe materials like rags, newspapers, or even going without protection altogether. Sustainable options like menstrual cups, reusable pads, and organic tampons are becoming more available, but affordability and accessibility remain key challenges. Advocating for menstrual equity, whether through education, donations, or policy change, is crucial in ensuring that no one is held back simply because of their period. UNICEF estimates that 1 in 10 girls in Africa misses school during their period due to a lack of sanitary products and facilities. Takeaway number 5. Nutrition and lifestyle impact your period more than you think. Your diet, stress levels, and lifestyle choices directly affect your cycle. Foods rich in magnesium, omega-3s, and iron can ease cramps and boost energy, while processed sugars and excessive caffeine can worsen symptoms. But it's not just about food. Exercise, sleep, and emotional well-being also play a role. Even light movement, like yoga or stretching, can relieve period pain. Prioritizing self-care isn't indulgent, it's necessary for a smoother cycle and a healthier you. Hydration and sleep are essential during menstruation. Drinking water helps reduce bloating, while proper rest stabilizes hormones. Takeaway number 6. The stigma around menstruation must end, and it starts with us. For too long, conversations about periods have been met with discomfort, embarrassment, and silence. But silence leads to ignorance, and ignorance leads to unnecessary struggles. Education and open discussions break the cycle of shame. Whether it's parents talking to their children, schools teaching proper menstrual health, or workplaces ensuring period-friendly policies. Change begins with awareness. Let's create a world where asking for a pad isn't met with whispers, where menstrual health is treated as part of overall health, and where every person who menstruates can do so with dignity and confidence. Your period is not a weakness. It is a biological rhythm that speaks of strength, endurance, and life itself. Thank you for being part of this conversation today. Keep talking, keep sharing, and let's continue to break the silence around menstrual health. Until next time.